Hi, my name is Katina Cuello, and I'm going to talk about the effects of electrical stimulation on chronic wound healing. First of all, we have a definition. The definition: the electrical stimulation can be used in the treatment and management of chronic wounds, since it assumes a safe, effective, and efficient management of the wounds. Current recommendation according to the FDA, that means Food and Drug Administration, for the use of the therapy are increased circulation and decreased edema. We have the different types of electrical current can be used for wound healing. Low intensity, direct current, transcutaneous electrical nerve stimulation, that is TENS, and high voltage pulse current. We have the HVPC, that means high voltage pulse current, is the most widely used for the treatment of chronic wounds. We have a video that you have to watch.
Hi there, I'm Darren Sorensen. I'm a student at Elon University for physical therapy. Today I'm talking to you about high voltage pulse current electrical stimulation to treat chronic wounds. In a study by Pollock et al. Titled High Voltage Pulse Current Electrical Stimulation and Wound Treatment, they used HVPC treatment for stage 2, 3, 4, and 4 pressure ulcers, as well as for chronic leg ulcers including venous lesions. Under the time frame that they use and the parameters that involve that we'll talk about in a little bit, they found significant wound closure after measuring wound size after 4 weeks. One study was followed up to full wound closure, but the rest had significant wound closure that correlated with full recovery from these lesions. So going through some of the parameters that they followed, the study was actually a correlation of several studies, and they found that the best parameters to follow was a pulse duration of around 100 microseconds, voltage anywhere from 50 to 200 volts, with the intensity being emphasized to be at the sensory level and not having any motor activation. The frequency was usually around 100 to 105 pulses per second, and each treatment session was roughly 60 minutes, 5 to 7 times a week. It was noted that in only 45 minutes of treatment, you could have significant wound closure in just that amount of time as well. So looking at the placement here, we have a nice ulcer here on my patient's leg, drawn with a blue marker. So for the first placement is directly within the wound bed, and the second electrode placement is 15 to 20 centimeters away from the treatment electrode in healthy, viable tissue. And in the studies that they researched, they found that using a negative electrode as a treatment provided the best results, and then a positive electrode on the healthy, viable tissue. So after performing these parameters, running the electrical stimulation for 45 to 60 minutes, there should be positive results after 4 weeks of treatment.
Okay, we have that promotes wound healing in acute and chronic stages, activate the healing process, a monophasic pulse current applied for one simulates or reinforced the bioelectric current and therefore healing. Cellular electrostatics of macrophages, neutrophils, and fibroblasts in the wound also promotes healing that improve protein and collagen synthesis and ATP and DNA production. It can increase blood flow and capillary density. It is effective in chronic wounds, venous ulcers, stage 2 and 4, pressure ulcers, UPP, and diabetic foot ulcers that promotes the growth of granulation tissue. We have another video that you may watch.
Preparation of the skin for high voltage pulse current. We have swelling at the ankle. We're going to apply the active electrode here on the dorsum of the foot, so we're going to clean the skin. And the dispersive electrode will be applied here at the lateral portion of the proximal tibia. Now we will apply the pads and connect the leads. As we attach the leads, notice that one of the leads is marked active, one of the leads is marked dispersive. So the active lead is the lead that I'll use and change the polarity to negative. The swelling typically is charged with a negative polarity, and so we'll use a negative polarity from the electrode here to push the swelling out of the ankle towards the positive polarity at the dispersive electrode. Dispersive, active, and we're going to set the polarity here to negative. The pulse duration is 40 to 100 microseconds. Many times that's preset within the unit. And what we are going to do is, as I add the current, I want you to feel a moderate tingling. Okay?
There.
Okay, good. You can tolerate that?
Mm-hmm.
Okay, and we're just going to leave that there for a little bit. We're going to remeasure the swelling and see if it makes any difference. Okay, if at any point in time you need us to stop, make sure you know we have a bell here that you could let us know. After the 30-minute intervention, we are going to ensure that the device is switched off. And now we're going to ask the patient, how are you feeling right now?
Good.
Okay. I'm going to slowly remove the pad and check your skin. The skin condition looks good. Observing for any rashes or wheals. Otherwise, the patient looks good and the treatment is complete.
Okay, we have some pros. That is applying electrical stimulation to people suffering from chronic wounds caused by peripheral circulation disorders that has been shown to help improve blood flow, which in turn accelerates the healing process. And like cons, we have the one of the most severe problems that affects the quality of life of diabetics is the appearance of foot ulcers. The foot is particularly vulnerable to circulatory and neurological damage, and the slightest trauma can cause pain and infection The latter can even lead the amputation of the limbs. Like conclusion, we have the management of electrostimulation therapy should be indicated for a wound that is difficult to manage. After the use of other therapies that have not had good results, although electrostimulation therapy works and has been shown in different studies, it turns out to have a complicated application both in primary care and in specialized wound units. The time required for the application of the therapy is quite high since it is spoken in studies of about 60 minutes. In more recent studies, between 15 or 20 minutes for 10 days in hospitalized patients using FI therapy, that is high frequency electrical current 4000 Hz. Nowadays, unfeasible from primary care consultations, so it should be delegated for the management of complicated ones that don't have good evolution. It also presents another complication, so that it is spoken on between 5 and 7 days per week of treatment, with which many patients would have difficult access due to geographical distribution, institutionalization, or mobility limitation. However, more research should be done on this therapy so that treatment times can shorten as new studies are presented. Our work is done on designing a few portable devices at affordable prices and easy to handle in order to educate patient and that they themselves were able to manage this therapy from home, either by themselves or by their caregivers, since there are studies in which the therapy was managed from home with good results. That will increase empowerment of patients that provides they will carry on their self-care. Right here we have the last video that you have to watch.
Focusing on you. Breakthroughs in precision medicine from your team of experts at UHealth, the University of Miami Health System.
Whether from an accident, a fall, or some other traumatic injury, chronic pain affects nearly 100 million people a year. But UHealth's Dr. Dennis Patton is offering a new procedure bringing relief to chronic pain sufferers.
Dorsal root ganglion stimulation is approved in the U.S. For complex regional pain syndrome and what's called causalgia, and essentially peripheral nerve injury. It's like a pacemaker for the nervous system. Electrical stimulation of this collection of nerves turns off pain, just like a light switch. One of the benefits of DRG therapy is very specific to a region of the body. With this device, we can just pick the region of the body we want to provide the pain relief in. We were very excited to offer this treatment to Alana. UHealth was the first in Florida to trial and implant such a device, and it's the first and only FDA-approved treatment for her condition and similar conditions.
The hardest thing with having CRPS is that we look fine, but we are really suffering inside. Dr. Patton is wonderful. Even though he's not in the pain, he understands your pain. My pain is a lot better. University of Miami has been my savior.
Focusing on You is sponsored by UHealth.
Thank you very much for watching.